We are joined now by Dr. Laura Gross of Stanford Health Care to talk about the latest with the coronavirus, the ever-changing information. Thanks for joining us, Dr. Gross.
Hi, thank you very much for having me.
Let's talk about the Bay Area reopening right now, just as we're hearing more about this new variant of coronavirus. Do you think that's wise?
Well, the opening decision was based on the fact that cases are going down right now in California and in the United States. And the projections are that over the next several weeks, hospitalizations will follow. And so we'll have more ICU capacity, which is what the Department of Public Health used in the first place to place the shelter-in-place guidelines. So that's great news, but we still have to keep our guard up and do everything that we've been doing to prevent spreading coronavirus, especially if a more contagious variant were to make its way to California, as it appears it may already be. So it's really important to continue to wear masks, of course. So you want to, basically, I recommend don't go anywhere where people aren't wearing masks. So if you, enter a store or enter a restaurant and you see people aren't wearing masks, it's a good idea to just leave. And you yourself should always wear a mask and stand back from people. They say 6 feet, but the further the better, especially if the variant is more contagious. And don't go to large gatherings. Basically, if you decide to eat out in a restaurant, it's not a good idea to meet your friend at the restaurant. That you really just want to eat with your immediate household family members who you're already in the bubble with. And even outside, if the variant is more contagious, you want to be far away from people who have their masks off.
Okay. So, I mean, when we talk about this new variant being more contagious, we need to be more careful than we've been in the past?
Yeah, absolutely. So taking the same measures, but just really doubling down and doing them all the time. Just don't be anywhere where people aren't wearing masks, and don't be the person who's not wearing a mask, putting other people in an uncomfortable position.
Right. No room for error. No margin
Right.
for error.
Yeah. And 6 feet is the recommendation, but if you can be further away from somebody, the further you are, the less likely particles are to be in the air.
Mm-hmm. Let's talk about upping the ante. Dr. Fauci recommending recently doubling your mask, 2 masks. What do you think about that? Is that going to be working out for people?
Yeah, I love that Dr. Fauci said that. The CDC hasn't said that yet, but it makes complete sense that adding an extra layer or extra layers could give you added protection. The best mask to protect you really is the N95 or the medical grade mask. Those are over 90% effective in preventing you from catching the virus if you're with someone who has the virus. The other masks the cloth masks are recommended for everyone to wear to prevent you from spreading it to somebody else. But there is some evidence that cloth masks themselves are protective against the virus. They're like 50% protective. And then now there's some studies coming out saying that if you double down on those layers, you could get up to 75% protection. So the recommendation is, if you can get a hold, of course, if you have an N95, you could definitely wear that to the grocery store, wherever you might be in contact with the virus. And then you'd want to double mask that because you'd want to protect your N95 because they're hard to come by. And so you keep your N95. If you're going to double mask a regular mask, the recommendation is to put the better mask underneath and then the cloth mask on top. So if you have a medical grade surgical mask, you'd put that underneath and then put a cloth mask on top. The cloth mask will help the underlying mask to fit better. So you want to get a seal around your face. So fit and extra layers both together help protect you from the virus getting in. I would add to that, it's a good idea to wear eye protection. So there's been studies that say that people who wear glasses are like 5 to 10% less likely to catch COVID. So if you're wearing some kind of eye protection.
Is that because we're getting it through our eyes?
Yes. It's not known to be as likely to catch COVID that way as it is to breathe it in, but yeah, it could go into your eyes. So in the hospital workers wear goggles.
Okay, so that would be an extra step.
Mhm.
And I don't know if you know the specifics of this, but there's the N95s, and then we're seeing these KN95s that are coming from China. Are those as effective as the N95s?
The KN95s have very good material, and the fit is good. So they are similar to N95s. So if you maybe not quite as good, but if you have a KN95, I would protect it and keep it and wear it. Mhm.
Okay, so we're in the hierarchy: N95, KN95, surgical grade mask, and then the cloth guys.
Yes, but the surgical grade mask and the cloth mask can be equal in that if you get a really nice fit on your cloth mask, that's equally important, because then the surgical masks are kind of loose on the outside because they're really made to protect the patient from the doctor. So they do work in preventing someone who has COVID from spreading it, but they let air in so you could catch COVID. So they're not as protective to the person. They're not PPE. But if you wear a face mask on top of it, it can really make the fit better. And there's some face masks now that are coming adjustable on the sides.
Okay. Okay. It's all about the fit.
Yeah.
Okay. That's some
Exactly.
That's some good advice. Let's talk about the vaccine right now, because now Johnson & Johnson's coming out with another one. Varying degrees of efficacy on these vaccines. And now we're hearing Moderna is coming up with a potential booster.
Mhm.
Where are we at with this?
We have great vaccines. The Moderna and Pfizer, 90 to 95% effective. And they're still studying whether or not they're effective against the variants. But it looks like they might be effective against the variants, just maybe a little bit less so, which is great. And the reason that they're working, both Moderna and Pfizer are starting to work on a booster, is that it's just preemptive. And we don't know where we're going with these variants. If we continue to have spread of the virus, every time a person catches COVID and spreads it to someone else, there's a chance of a new variant. So if they're practicing and getting ready for, should we have a variant that the vaccine isn't effective for, they'll have a booster ready to go.
Okay. And
Mhm.
so we could have confidence in those boosters. I memean, who knows what this thing's going to mutate into?
Yes, we can definitely have confidence in the boosters. So the boosters are in case the vaccine doesn't have long-lasting immunity. So if it doesn't last for more than a year or two, we'll need boosters. And if there's a variant that is not that the vaccine isn't effective again, we'll need the boosters. But the good news is that all they have to do is change the mRNA slightly and then make the vaccine in the same way, and they have their booster ready for us, ready to go. So they're just getting ready for that.
Okay.
Mhm.
That's good news.
It's great.
Looking ahead, at what point do we achieve this widespread immunity? And at that point, do we not have to worry about it anymore?
That's a great question. With the vaccines rolling out and hopefully every person in the US having a vaccine available to them by the end of summer, it could be end of summer next year that the virus isn't as lethal as it is right now. So there's some thought that in the future it'll still be around. It's not going to go away or die out. But with everyone being immune to it, it'll be more like the common cold. So of course there'll still be cases here and there of people getting really sick, but it won't be 1 in 100 people passing away from it.
Okay, so
And
maybe
that's soon.
like a seasonal flu situation.
Yeah, maybe not even as bad as the flu, just like a regular cold. And it may
Okay.
not be seasonal. It just may be all the time. Mhm.
Yeah, this thing does not seem to know seasons.
No, it doesn't.
Dr. Laura Gross with Stanford Health Care. Thanks for all of that advice.
Thank you for having me.